So good evening. Welcome, everybody. Joining me this evening is going to be Dr. Don Meichenbaum. We're just trying to get him the right link to come in. And also Chris People, who's one of our trainers and tutors with the college, has been working very intimately with Don for quite a long time now, working with Don's course, Essence of Psychotherapy. Also joining me this evening is Lindsay Trail, who's trained with the college and has a practice in California, I think. Is that right, Lindsay?
That is correct. Los Angeles, Santa Monica, to be precise.
Fabulous. And Lindsay's also recently just started working as being one of our tutors and coaches as well, for those of you taking the diploma. So that's fabulous. And also joining us is Heather Leeson, who also trained and qualified. When did I know Chris, you said was your tutor, and when did you qualify, Heather?
I think it's coming up 3 years ago now.
3 years. Wow, fantastic. So that's great. So we're going to have a great panel that are going to quiz Don with some questions and draw out even more of his wisdom, compassion, and humor. Do say hi in the chat, and also love to hear from those of you who will be meeting Don for the first time, and also those of you who, where you are with your diploma, if you're taking your diploma, but also if you're still thinking about it and looking at it, or maybe you got just no interest at all in our program, but you want to meet Don. That's all fine. Welcome to everybody, and love to hear from you and pop your story in the chat there. We've also got a Q&A panel, so you can put your questions and answers in there. And I know some of you put your questions for Don into the registration form, and we have all those. So we're going to try and get through everything once we get Don in. While we wait for Don coming in, as well as saying welcome to all of you, I'm going to say this is being live streamed on YouTube, so behave yourselves. And also it's being recorded, so you can come back in there. Lindsay and Heather and Chris, behave. It's being recorded, so if you have to leave early, don't worry, it's going to be available, and it'll probably be available free and openly on YouTube. This is the sort of thing we really want to share with as many people as possible, so do share it with others too. As we're waiting, let me plug another event that's coming up that some of you I think are going to find interesting, and that is a webinar that I've been planning for a while with Dr. Chrissy Ivings. Chrissy is a senior NHS clinical psychologist. She did her research quite a long time ago in smoking cessation, then moved on to working in CAMS. And then when she came and trained with us in Hypno-CBT, which she absolutely loved, despite being massively qualified in clinical psychology and CBT, she also reinvigorated her love of smoking cessation. That was her topic of research when she did her doctorate, and she published a book back then. She republished her book, and we've been talking quite a lot because I am not only do a lot of work smoking cessation, been teaching a class in that for a long time, worked with hundreds of smokers, but also anti-vaping in terms of I think it's a disastrous policy, and we're creating a whole generations of nicotine addicts, and it's not just people addicted, that means they're going to be more depressed and anxious. That's the effect of nicotine. So we're going to be talking about Chris's new book. We're talking about our approach, different approaches to smoking cessation, but we're going to be particularly talking about vaping and government vaping policy and why vaping is a disaster, what we can do to help people, and also kind of warn them a little bit, and what are going to be the impacts of vaping. So that's going to be, I think, very interesting, very juicy. We'll talk about I think I also got a hypothesis about Freud. He died because he couldn't stop smoking. His dog left him because he couldn't stop smoking. Committed suicide, essentially, because he couldn't stop smoking. And also Jung was a massive nicotine addict. Two of the fathers of psychotherapy, completely nicotine-addled nervous systems. Quite interesting. So my little hypothesis on that we'll get into during that. So do join us. That's Thursday, October 30th, 7 p.m. That will be recorded, and it will be available as well. But we'd love to have you live with us then. That's Chrissy and I on Thursday, October 30th. So back here, how are we doing, Chris?
We're doing well. I'm just wondering if Don is in the main group.
Let me have a look. I have somebody called Don, and if it's another Don, he'll do.
Great. We'll take it. We'll take it.
And I think you have a little video to share. Is that right? It's a bit at past. Once we get Don in, let me try promote to panelist. He's being resistant to come in as panelist. Promote to panelist. Why doesn't it let me promoting him?
Don just gave me a stern talking to about only taking 5 minutes to introduce him, and I've rarely this occurs actually, but I have actually put my foot down tonight and said, no, I think you deserve 10 minutes. So I hope everybody will allow me that to do him and his career justice. So.
I keep trying to promote him. He keeps refusing. I don't think he's got the promote to panelist. John's going to be rejoining the webinar as panelist. Excellent. Here we go. There you go.
All right.
Oh, is that David
Welcome, Mark.
there as well? Hello, hello.
My good son Dave is here to help
Hi,
me.
David.
Oh, hi, David. We haven't seen you before. Lovely to see you.
Yes, we got him connected. This is a win.
Fantastic. This is a win.
Yes,
Thank you so much.
you're welcome.
Good evening, Don. Well, probably good afternoon where you are. Thank you so much for joining us.
Oh, it's my pleasure, and thank you for the opportunity that you and your organization have provided me with to introduce my recent book. I'm actually in Buffalo, New York, and I'll follow Chris's intro with a discussion of how we can reduce violence in this. This is prevention of Domestic Violence Month, so this is a very timely presentation.
Fabulous. Okay, so I'm going to fade into the background here because I am nursing a cold and a cough. And I don't want any of that to happen on the screen here or on the camera lens. So I'm going to disappear into the background. I'm going to let Chris do a brief intro to you, Don, that you've got to give him space to do. And I'll pop back in towards the end, but I shall be listening. Don't worry. Have fun, everyone. And Chris, take it away.
Thank you so much. And Don, I've let everybody know that you gave me a stern talking to that I was only allowed to introduce you for 5 minutes, but I might take a few liberties with that if that's okay. So good morning, everyone. It's a pleasure as always to be here with you. Is everybody seeing my presentation screen okay? Or is it my fellow panelists? Is that okay? Yeah, great. So welcome. What a treat for all of us, and it's always lovely for me to be here too. I'm going to actually take a bit of a back seat here as well, don't you worry, and I'm going to hand over to my wonderful colleagues and of course Don himself. But I did want to set the scene for everybody a little bit if I can, and I'll try and help out in the background. As you know, Don Meichenbaum will need no introduction for many of you. However, I will still do an introduction, and I'd love, if that's okay, very quickly to introduce my colleagues. Lindsay, who is a UK college tutor and practicing hypnotherapist, and also Heather. Both of you, would it be okay just to say hi and just say, for those of people who are perhaps coming slightly late into the moon, just
Yes, of course, Chris. Hello, everyone. I'm Lindsay Trail. Some of you might recognize me from practice sessions or perhaps some of our coaching sessions at the college. It's lovely to see you all tonight. It's particularly exciting for me to meet Don as well tonight. I did his legacy course a few years ago, and it was a really amazing experience for me. So yes, I'm in LA. I have a cognitive behavioral hypnotherapy practice here. And yeah, I'm looking forward to speaking to you more a bit later on in the session. I'll hand over to you, Heather.
Hi, I'm Heather Leeson. I qualified at the college 3 years ago. I'm nowhere exotic like Lindsay. I'm based in Maidstone in Kent. Yeah, I work as a therapist here and really enjoyed doing Don's legacy course last year. And also had the great honour of actually having him online a couple of times to kind of talk through a couple of case studies I had, which if you ever get the opportunity to do that with Don, take that opportunity, because it's just a real opportunity to learn from the man himself. Yeah, and really looking forward to tonight, really, and being a part of it. So thank you all and enjoy.
Thank you so much, both of you. Let me do this formally. Welcome to Dr. Donald Meichenbaum. Don is a founder of Cognitive Behaviour Therapy. He's the pioneer of stress inoculation training, of self-instruction training, and latterly in the constructive narrative approach to psychotherapy. In the latter part of the 20th century, he was voted one of the most 10 influential psychotherapists of the 20th century, alongside luminaries such as Carl Rogers, Sigmund Freud, and Albert Ellis. He was professor and still is professor emeritus in clinical psychology at the University of Waterloo, and still holds the position of research director at the Melissa Institute for Violence Prevention and Treatment. And that, I believe that's a position you've held, Don, for almost 30 years. Don is also the senior advisor to the UK College of Hypnosis and Hypnotherapy, and so helps guide our clinical training here. If that's okay, just for a couple of minutes, I'd just like to let everybody have have someone else introduced Don, if that's okay, just to give a bit of scope to his background. This is a lovely video provided by the University of Waterloo.
In the complex field of psychology, Dr. Donald Meichenbaum has left a distinctive mark. In the 1970s and 80s, he was at the forefront of a new approach to psychology called the cognitive revolution, which changed the way psychologists thought about thinking.
Don introduced the idea that is compelling, but at the time was revolutionary, that we need to take into account what people are thinking if we want to understand how they feel and how they behave.
Dr. Meichenbaum helped set the foundation for cognitive behavior therapy, which asserts that by changing thinking patterns, one can change unhealthy actions into healthy ones.
It tries to make clients aware, increase their awareness of the way in which feelings, thoughts, behaviors, and various kinds of consequences come into play, how they interact. Well, I'm wondering.
One technique Dr. Meichenbaum uses is to train people to change the way they talk to themselves. He calls it New York therapy because people there do it all the time.
One of the things that we ended up doing was to take that kind of New York style coping technique and translate it into a form of therapy to teach people to increase their awareness and to talk to themselves in more adaptive ways.
The drive, Dawn. In treating patients, Dr. Meichenbaum puts an emphasis on getting them to collaborate and play a key role in their therapy.
How would you know if these procedures are indeed helping you? What would you see change?
I seem to want to, when I was feeling a little better, like
the quality and nature of the relationship between the helper and the client is the glue that makes the therapeutic procedures work.
I think Don actually likes problems. But the problems that the rest of us say, oh, why me, Lord? He kind of grabs hold of and takes charge and figures out neat ways of thinking about them.
Dr. Meichenbaum has treated survivors of traumatic events and people with violent tendencies. As a result, he's published handbooks on how to assess and treat people with anger control problems and post-traumatic stress disorder.
We live in very troubling times. All you have to do is look at the 6 o'clock news and see the high incidence of terrorist attacks, war, and the like. So to prepare people for that, that's what the book was about.
Dr. Meichenbaum spent 30 years teaching psychology at the University of Waterloo until retiring in 1996. He then focused on consulting and lecturing worldwide, along with his position as research director at the Melissa Institute in Miami, Florida, a nonprofit organization focusing on violence prevention.
My hope is to make society a bit safer for my children and grandchildren, and to give research away so that clinicians, educators, and those who formulate public policy can do so being informed by research.
In a distinguished career still going strong, Dr. Donald Meichenbaum feels his work isn't done.
I have a lot of dreams yet to fulfill. And that sort of gets me going and keeps me going.
So a lovely little intro, and I think sets the scene really nicely for us today in Don continuing his work, and hopefully he'll tell us some of his recent developments shortly. I need to just quickly say how extensively Don has published over his career. I think he has a collection of more than 20 textbooks, including his most recent publication, Choosing Wisely, which we're all here to talk about today. For anybody interested in evidence-based psychotherapy or CBT in particular, his recent publications are absolute sort of must-haves in your collection. The Evolution of Cognitive Behaviour Therapy and Roadmap to Resilience are on my desk as we speak and are strongly recommended, I think, for everybody who is in our profession. I should also mention, and Don would, I'm sure, would like me to, that the Roadmap to Resilience was released into the public domain free of charge. I believe during COVID, Don, right? And yes. that is available at that web address there, roadmap to resilience.wordpress.com. So the information is freely available. And of course, we're now here to talk about his latest publication, Choose Him Wisely. I will just quickly mention his wider academic research. I think I tried to count Don's academic papers recently, and I think it was about 70, I believe. I might be off plus or minus a couple there, but it was absolutely extensive. And in particular, how to spot hype in psychotherapy, an 18-point checklist was an award-winning publication in 2018, and is probably a must read and is available both at the Don Meichenbaum website and at the Melissa Institute. And I would strongly recommend anybody interested to check that out. It's a fascinating read and will absolutely make you examine your own practice. For those people who are not aware, the college and Don, we've been working together for a few years, dating back to the first lockdown, I think. And Don did a webinar for us on PTSD and resilience during lockdown, and many of you will have access to that whole day webinar already. And subsequently, later that year, we started the development of Don's Essence of Psychotherapy program, which took a significant amount of time and effort to develop on everybody's part, because in 30 modules, Don has tried to do the impossible and distill 50 years of clinical practice and research into a single course, which Don likes to refer to as his legacy course. It's an incredible piece of work, which all of us here who, everybody on this panel has had involvement in, and has been an absolute incredible experience. For those of you still working with your training, I always champion this one as your what's next training option. We've also helped Don to try and publish his own website. Don has given freely of his information over the many years, and we wanted to make sure that there was somewhere, a place on the internet where all his material could come together in a single place. And as we mentioned earlier, Don now acts as as the senior technical advisor to the college's technical advisory board. I want to try and move along and to get into the meat of the evening, if that's possible, and hand over to my colleagues. We're here to talk about Don's most recent publication, Choosing Wisely. I believe it was officially released yesterday and is now available in all major bookstores. Lindsay, I believe, got her ebook copy last week, so great, and I'm sure she'll have some insights there. And I just wanted to bring everyone's attention to the fact that although this only just formally released, it is already receiving some absolutely critical accolades, including from the amazing Christine Podesky, who in her own right is a powerhouse in the field of CBT and psychotherapy. We should also quickly mention that this is a co-publication with David Wexler, and David isn't with us tonight, but David is also a very experienced and actually high-profile clinical psychologist in his own right, and it's only right to pay tribute to his excellent work here tonight as well. So with that, if that's okay, Lindsay, I'll hand over to you, and I'll take a step back if that's okay.
Sounds good to me, Chris. Thank you, Chris. And Don, before we start our questions, I wonder whether I can just share a few stats with everyone about domestic abuse in the UK.
First of all, I need to thank Chris, and I hope I live up to that introduction. But in the book, Choose Him Safely, I review the statistics mainly in the United States. So I welcome you sharing the incidence of domestic violence that occurs in England.
Great, Don. Well, just to start with, globally about 1 in 3 women, around 30%, experience physical or sexual violence in their lifetime, most often by an intimate partner. And in the UK specifically, in the year ending March 24, an estimated 2.13 million people aged 16 and over experienced domestic abuse in England and Wales, 1.6 million women, and 712,000 men. And in the year ending March 24, the police recorded 1,350,428 domestic abuse related crimes and incidents in England and Wales. And among those, 108 domestic homicides were recorded, of which 83 were women and 25 were men. 66 of those 108 victims were killed by a partner or ex-partner. So yes, this is a very relevant subject, and as Chris said, in this month of domestic abuse awareness, we are so grateful to have Don with us today. So, Don, I wonder whether I can ask you, our first question, which is really, how did you come to write this book, at this time?
Well, that's a very interesting story. Let me challenge both you and your audience before I get directly to that question. So the question is, what do the following women, who are very talented and attractive, all have in common? So consider the following entertainers: Loretta Lynn, Aretha Franklin, Whitney Houston, LaToya Jackson, Pam Anderson, Mariah Carey, and in my day, Doris Day. So what, Lindsay, do you think all of these women have in common as I list them?
Well, I think I know the answer, Don, as we're here today. I know at least 1 or 2 of them I have been in violent relationships.
Yes, each one of these women have hooked up with a male who either psychologically or physically abused them. So here's the question. What is it that these smart women, talented women, miss in choosing a mate? How can they assess the violence potential of prospective partners? That's what the book, Choose Him Safely, is all about. I am going to share both with you and your audience the warning signs, what are the red flags, and then 5 particular strategies teachers and women can use in choosing a mate. In going through this, I should note that these same risk factors apply with regard to men choosing women, or for that matter, homosexual couples choosing a mate. That is, the incident and nature of the risk factors seem to be apparent and valid across all kinds of couples and across all kinds of socioeconomic groups, religious groups, cultural groups, and the like. So this is a really challenging issue and the like. Now I'll get to your question with that as kind of prologue. I am now 85 years of age. I'm actually offering this from Buffalo, New York. But I also have a home in Cape Cod. For the last 2 years, I lived there with my granddaughter, Anna. She, in fact, was a constable in a nearby town called Wellfleet, raising oysters, monitoring them, and the like. Well, each Monday night, she would turn on a television program called The Bachelorette. Now, I was sort of stuck in the home with her. It's a small house, and we would listen to the Bachelorette program, and I would argue with her, saying that the Bachelorette actually has been asking the wrong question when she is choosing a mate. I then enumerate the variety of questions that I would ask. So I had this collection, and we discussed the various strategies that she, who was in the midst of dating, could follow in assessing the violence potential of a prospective partner. Now, to complete this story, I should note for you and the audience that this last year I've had a heart condition, and my heart actually stopped 14 minutes. I now have a pacemaker defibrillator and PIC that goes directly into the heart. And I try to remain as resilient as possible. Well, following this incident of the heart attack, I was put in a rehab. Well, the rehab center had 100 cases of COVID. So I was pretty much confined to my room for 3 months. So what are you going to do for 3 months locked in a room? So I decided to write this book, Choose Him Wisely. And I hooked up with my very knowledgeable colleague named David Wexler, who is an expert in this area. And we actually wrote the book out. So it's a bit winded. I didn't mean to get too long in this intro, but that provides you and the audience with some background. So let me move right to the topic at hand, okay? We now have, both from research perspective and our own clinical experience, an appreciation of what are the warning factors. Well, the first one that an individual should be aware of is what is known as love bombing. Love bombing. This is when the prospective partner is highly gratuitous in his attention and affections for you, the prospective partner. He will show a great deal of attention to you, and especially if we have a female who is looking for a partner and feels needy along the way. These guys are very good in trying to pressure you, the partner, into making quick decisions with regard to intimacy, living together, finances, and the like. At first, the way they come across is seen as really very attractive, and one is swept off her feet as a result of all this attention and affection. But slowly, over the course of time, this kind of love bombing translates into a kind of aspect of control and power grabs. The male may try to monopolize you, fail to respect your boundaries, isolate you from significant others, belittle and degrade you. At first, the relationship may be quite positive, but over the period of time, there is some real concerns. So the first kind of notion is, how can we look for these kinds of red flags to begin with? There are several other strategies that I will describe in a moment, but before doing so, let me invite both Lindsay and Heather to see whether they've had any similar experiences, either for themselves or for their clients. And then we'll go through each of the strategies in turn. I will also invite, at the end of this presentation, opportunities for the audience to raise questions, to share their reactions and experiences. Without further ado, let me just turn it to Lindsay and Heather and see what response they have.
I think I can talk from a personal point of view. I was in an abusive marriage, but also I've worked with many clients who have been in abusive relationships as well. And I think the love bombing at the beginning is a really hard one to deal with, because what you're presented with is the perfect partner. So you could be going into a shop and you casually mention you like something, it's bought for you. You could say that you're, oh, I'm not sure I can cover that bill this month. Don't worry, I'll cover that for you. Everything, I want to spend as much time with you as I possibly can. And I know for me, within 6 months of meeting my husband, he proposed. It was very, very quick. In terms of sort of the taking control, I've had clients who've said that their phones have disappeared. They thought they've lost their phone and then it's reappeared. They've had friends asking, why haven't you responded to my message? I messaged you about doing something. They never got those messages because those messages have been intercepted. Those messages have been deleted. So it's just the gradual kind of drip by bit of taking over. And with finances, for me, I ended up with no access to a bank account. I had to ask for money to be transferred into a bank account for me to use. And it's hard when you look back. You had this perfect person who quickly over time kind of unravels into something that you never expected to be. So what are the other red flags that we should be looking for, Don? What else should we be looking out for at the beginning to,
Well,
alarm bells?
thank you for sharing those personal accounts. Let me, before I move on to the other considerations of factors, let me just see if Lindsay has any observations to make with regard to love bombing.
I don't deal with any clients day to day on this subject, but I have, a personal interest with 2 teenage girls and a teenage boy. So I think it's really interesting, and I've seen this myself, love bombing with friends, and always been slightly sort of jealous of such attention, thinking how wonderful it was that their boyfriends were like that or girlfriends were like that. So it's a really interesting point.
You know, over and above love bombing, we have suggested a second strategy that's critical is to have women trust their gut. That is, while psychologists have tried to identify various kinds of markers, for example, like attempting choking during sexual activity, which is in fact one of the most important predictors of violent behavior. In the United States, this has been called femicide to replace the term homicide. So we have enumerated in the book a variety of emotions that a woman may experience in these kinds of social discourse. They feel as if they're walking on eggshells. They may feel anxious or afraid. They may feel occasionally abandoned or angry. So they have both primary and secondary emotions that color this. And here's an interesting anecdote that underscores the degree to which you can trust your gut. My dear wife, who was actually, unfortunately, killed 2 years ago, run over by a truck, and we've been married 58 years. She and I had a really good friend who had been a victim of a prior abusive relationship. Well, after several years have gone by, this woman decides that she is going to try hooking up again with someone. So she meets someone online in kind of eHarmony, and she invites my wife and I to join her for dinner. Well, I don't really want to attend this thing, and I'm okay. She insists, and my wife says we have to go along in order to protect her. So in my head, while I'm eating with this gentleman, I have a 2x2 cell that I'm filling in, which is risk and protective factors, both current and past. And I'm plugging things into my head, and afterwards, when I'm on the way home, just give you a sense of trust your gut. I turn to my wife. I say to her, "What do you think?" And she looks at me, she says, "It's high risk." What? I say to her, what do you mean it's high risk? What did you see him do or say? What did he not say or not do that convinces you at your gut level that this is a risky behavior male? And she looks at me and she says, "Did you see the way he eats?" I say, "What?" She says, "Did you see the way that he eats?" I said, "No, the entire time he's talking with his mouth full. I'm telling you, that's a high-risk behavior." I turn to her and I say, "There has never, ever been any research on the eating behaviors of high-risk versus low-risk men in that situation." Well, to make a long story short, I have 4 children. And for each of them that they brought home a prospective mate, we fed them. So it turns out that my granddaughter met a very nice man, and she's getting married next June. So not all men are toxic, as we will see. So the first thing is to look out for love bombing. The second thing is to go to the book and see the variety of emotions that a woman might experience. It is the job of each female to ascertain what are the presence or absence of risk factors that are in the background of the prospective mate. Now, a couple of things that we should know is that aggressive behavior is relatively stable over one's lifetime. In fact, if you look at the relationships, aggressive behavior is about as stable as is your IQ over the course of your lifetime. So therefore, the major kind of concern that we have, that we highlight in the book, is what we call the art of questioning. We go through and highlight the variety of questions that a woman should ask a prospective partner in terms of what we call how and what questions. How did you decide to, what is it? And one of the surprising questions that we found quite useful is for the woman to ask the person the question, is that a tattoo I see on your arm or body part? You know, I often walk by many of these tattoo stores and I am concerned, how do people come to choose that particular tattoo? People love to tell stories about the tattoos that they have. The presence or absence of a tattoo per se is not problematic or predictive. But when they start to tell the story that this was a tattoo of my grandmother, or this was when I was a gang and so forth, in fact, if you look at the tattoos of men who are imprisoned, they often have under their right eye a variety of teardrops. And it turns out that each teardrop represents a violent behavioral act. So therefore, we enumerate in the book the variety of risk factors, both developmentally as current, that you, the partner, should be aware of. Do they have a history of violent behavior? Is there a high incidence of substance abuse or mental illness that they've experienced in the past? How do they relate to their family members and to their peers? Are they preoccupied with violent television, movies, pornographic films, and the like? I won't enumerate all of the risk factors here, but as you turn your attention to the book, you could see that there's a presence there that I'm concerned about. Closely associated for the looking at these risk factors is that you can search the social media of your prospective partners. At least in the United States, you can go on and see if your partner has any record of a DUI, that is substance abuse, while driving. If they have a clean slate, that's one thing. Not all DUIs are recorded. But if in fact there is a presence of a DUI, that should give you, the prospective partner, a pause before you hook up. Closely related to that is that people on their cell phone have various kinds of social media, and you can share your social media with that of the prospective partners, and you can learn a lot about who they hang around with, their vacation sites, their hobbies, and the like. Well, let me just summarize where I am thus far. We're looking for love bombing. We're secondly trusting our gut. Third, we've developed the art of questioning, of how and what questions that will permit us to identify potential risk factors and protective factors. I have a couple of other strategies, but before I turn my attention to these, let me once again turn to my colleagues, Lindsay and Heather, and see if you have any reactions to what I've just been describing.
I had a question, Don. I wondered which one you thought was the most important to look out for. You mentioned that aggressive behavior is stable over a lifetime. You know, if you saw aggression, is that just a real no-no? You don't even need to go to the social media, or are they watching violent stuff on TV? You know, if they're aggressive in any way, that's that.
Well, to answer your question, we know that past behavior is the best predictor of future behavior. So if you can find out any particular incidents of where this individual has been violent, for example, if he's had a relationship with others, what led to the breakup of that? To what degree is there verbal or physical abuse in the past? That becomes important. A second one that has emerged in the literature is that there's a high incidence often of choking behavior during sexual acts. And it turns out that choking behavior is really a major no-no to pursue any of these other kinds of issues. There is no one marker that is the best or only. Once again, I would go along with the partner trusting their gut. If they feel that there's something wrong in the relationship, this should give them pause, especially as I turn our attention to two further strategies that could be used. Does that get close to your concerns?
Yes, Don, thank you. I think that's clear.
Heather, did you have anything that you want probed at this time?
Yeah, can I just ask around the intuition? Because I know, and probably for all of us who work here as therapists, that some of our clients come from backgrounds, childhoods, where their trust, because of what their past experiences, is kind of, they don't always know what to trust and who to trust. So sometimes their intuition might not be firing as maybe other people's would be. So how would a person who maybe comes from past trauma, who's maybe suffered abuse as a child, whose trust, you know, they've trusted an adult who they thought they could trust, how would they then still work with their intuition?
That's a really good question. And clearly there are some women who seem to be more vulnerable to these kinds of relationships. One of the things that's impressive is that women have the ability to cognitively reframe, disown, discard. They engage in what I call mental calisthenics, or they engage in little white lies. So they end up convincing themselves that they should stay in the relationship. They report to significant others that you don't know him the way I know him, that I will fix him, that the only reason he was violent was because he was overly worked up and stressed out, that he had drunk too much. Therefore, the women have the ability to reframe any particular incidents, and this leads them to stay a little bit longer than perhaps they should. If they have an attachment style where the question of trust is a vulnerable feature of their own particular pattern, this kicks into my next strategy. And the next strategy is that these women should seek information from trusted others, their family members, their friends, and permit them to observe them with a prospective partner, and then solicit from the friends any kinds of feedback as to whether they have any concerns about the way in which there's been social discourse between the prospective partner and themselves. In the book, we cite a classic case of a woman named Gabby Petito. She was the subject of a major documentary in the United States on domestic violence. Over the course of time, her boyfriend, Brian, psychologically and physically abused her, and he eventually killed her, and he killed himself, actually. In the book, we highlight the number of times Gabby dismissed, reframed the kind of feedback she was receiving from her friends and family members. So if issues are of trust, it's unlikely to show up just with regard to this prospective partner. But this is something that the woman should recognize as a vulnerability factor and obtain feedback from others she trusts during the course of time. Does that get close to your concerns, Heather?
Yeah, no, thank you. That's really helpful to explain that and unpack that. Thanks, Don. I appreciate that. Thank you.
Yeah, so we have love bombing, we have trust your gut, we have the art of questioning that look at risk and protective factors, and now we have the occasions whereby an individual can solicit feedback from significant others that would be helpful in them making a decision. There's one other strategy I'd like to suggest, and that is during the course of a relationship with significant others, there will be occasions when you disagree, have a different opinion, or want to make a different decision than your prospective partner. Such naturally occurring events provide you, the woman, with an opportunity to engage in what we call a behavioral experiment. You can see, how does your partner respond to such moments of disagreement or post-decisional discourse? You can not intentionally provoke these events, but they will occur spontaneously, and you can see these as an opportunity to get a behavioral sample of what may occur in the future. So those are my 5 steps that we comment on. The other aspect of what we comment on in the book that's also critical is a recognition that when a woman is in the midst of leaving a potentially violent situation, she is particularly high risk. That's a critical moment in time. And we spend some time talking about what are the kinds of safety concerns that women should have if they find themselves in this kind of situation. Finally, I do not want to convey that all men are toxic. Apropos of my granddaughter, she has found a loving, caring mate. And I wish all the people who are hearing this video a similar outcome. But nevertheless, I hope the audience who are listening to this tape will in fact share the information about the book and about this presentation with significant others. We honestly believe that one of the best ways of reducing the incidence of domestic violence, spouse abuse, is to help individuals, both male and female, make safe and smart decisions. Insofar as all members of this audience, including yourselves, can help spread that word, then maybe we can make the world a bit safer. Maybe those talented, attractive women would have not hooked up with domestically violent men to begin with. Note that psychological abuse is often worse than physical abuse. I will also note that Dan O'Leary has studied domestic violence in high school students who are dating. He has found out that at least 40% of those couples engage in some form of abusive situation. So when I talk about the stability of this, it is evident as we study the couples along the way. I wish you all well in selecting a mate. I will pause now and see if Heather and Lindsay have any particular comments, questions, or observations, and open it up to Chris and others to see if the audience has raised any questions or reactions to what I've presented so far.
Thank you, Chris. Thank you, Don, very much for all of that tonight. I have briefly read the ebook, and I thought, what an amazing, although I was reading it on my phone, which I've never read a book before, I thought how great it is that you can read your book on a phone now and you can get an ebook, because for anyone who's in this kind of situation, they wouldn't want to have this kind of book lying around, would they, for all to see? So I hope that makes it very accessible to a lot of people.
I agree with you.
I wonder what charities
I think it would be fine to have the book lying around. I think men should read this as well, in terms of how they could occasionally become toxic. You know, making people self-aware of the incidence of domestic violence is a first step for changing behavior. So I am as eager to have this sitting on the counter for any couple. And then you want the couple to say, what the hell is that book about? And, you know, then the woman can explain what she was on the lookout for and the degree to which this guy does not manifest those behaviors.
And you do talk at the end, Don, about how there is a possibility for change. There is an opportunity for men to change if they are aware. Is there any kind of data on this, or do you have any personal experience with this?
Well, if you go to the Melissa Institute website, you will see we reviewed in my book on anger control and my colleagues reviewing the data that in fact psychotherapy can help people who are violent engage in socially acceptable behavior. We enumerate in the book here what are the steps that these men have to engage in, what they have to say, what they have to do in order to make them a good candidate for psychotherapy. One's history is not one's destiny. And I'm a person who has been preoccupied with resilience and have written about it a lot on the website. You can go and look at it. In fact, I just may note, about a month ago, I was invited to present to the mental health community of the country of Ukraine, who are experiencing all kinds of war-torn traumas. And while trauma is everywhere, so is resilience. And in the aftermath of some kind of trauma experience, 3/4 of the victims of that trauma, no matter what kind it is, natural disasters, interpersonal violence, 3/4 of those individuals will be impacted, but they go on to evidence resilience. 25% of people get stuck. And Chris noted at the beginning, I have made available for free my book called Roadmap to Resilience, .wordpress.com. And I invite the entire audience to download this free book, in which they will discuss what distinguishes the 25% of individuals who get stuck, who develop PTSD and related behavioral and mental disorders, versus 75% who make it. It is hoped that by looking and sharing this book, we will be able to increase the likelihood of resilient individuals. Everybody has the potential of improving their level of resilience.
Your history is not your destiny might be one of my favorite things that I've heard you say, Don. So thank you so much. There were a couple of questions that have come in already, and I'd really like to give John an opportunity to do that before he goes. From my panelists, is there anything else we'd like to ask from our side before we do that?
No, I think that's a good idea, Chris, to go to the audience questions, unless Heather.
No, I think let's go to the audience, because I know there's quite a few questions in there, so let's give them a chance as well.
Okay. In no particular order, Don, there was a question that came up quite recently, which was about neurodiversity and helping people understand how is there any advice that you're aware of, perhaps not necessarily in the book, but in the wider sphere of knowledge, about helping people with neurodiversity to navigate these kind of situations, to help them identify the behaviors that we're talking about here?
Well, apropos of the presentation I gave to the mental health workers of Ukraine, a couple of things stand out. One is there is no one way to foster resilience in individuals. And on the Melissa Institute, I have various handouts, and also included in the legacy course, on how to bolster resilience across the entire lifespan, from high-risk children, adolescents, adults, to even the elderly. And it is clear that some of the elements that contribute to resilience have to do with the nature of social supports. The second has to do with flexibility. There are some stresses that people encounter whereby you, the individual, can take direct action and try to address that problem. Apropos of the work that we've done on stress inoculation. And there are some stresses out there that we have no control over, per se, and the way in which you, the individual, can use palliative coping devices, spirituality, meditation, and the like. George Bonono, who we have had discuss a presentation on the Melissa Institute. All these presentations are available to you for free. Has written a book about the end of trauma. And he talks about the need for flexibility, and that the more resilient individuals, the people in that 74% group, are able to alter which strategy they use depending upon the demands of the situation. Over and above the social supports and flexibility, there are a number of others that have been found to be significant, including exercise, looking after one's case. It's interesting to note that there's increasing data that experiencing positive emotions of gratitude, forgiveness, love, a sense of awe, and the like actually have physiological benefits. The body keeps score not only of negative emotions, but in fact, the body keeps score of positive emotions. So engaging in these various activities that I enumerate can enhance the level of resilience of other individuals. Does that get close to the concern of this person asking, Chris?
From my side, that's wonderful, Don, and I'll invite them to anybody to ask follow-up questions before we go if they would like any further information. This is I'm joining several questions together here, and I hope that works okay. There's some questions about recovery from victimization and helping. The question here is women, but I think what we actually mean is all victims to stop themselves from doing those kind of mental gymnastics or mental calisthenics, as you call them, that help them dismiss and reframe actions of their abusive partners. Is there any particular approach or methodology that you recommend or you know of that help people in their recovery?
Well, I have enumerated the core task of therapy. And it turns out that the quality and nature of the relationship between the patient and the therapist is 3 to 4 times more important than the specific procedures you use. So therefore, to the degree, when I'm encountering the kind of individuals you're describing, I need to show them a great deal of empathy. I need to develop a trusting relationship. I need to acknowledge and validate the pain that they're coming in with. I have to have them appreciate that they're not merely a victim, but there's also a survivor of that particular incident. I engage them in a therapeutic process using the art of questioning, of having them appreciate the interconnection between the way in which they appraise events, there's primary and secondary emotions, thoughts, and behaviors. I want the client to recognize that they inadvertently, unwittingly, and perhaps even unknowingly come to produce and maintain the kind of problems that they're complaining about right from the outset. I try to nurture in them a kind of personal agency. And much of this is incorporated in the book on Choose Him Wisely. So there is an art of doing psychotherapy that we have struggled to capture in the legacy course that you and the college are administering. So I encourage the person to avoid argumentation, to avoid saying to the person how they should feel. I encourage therapists not to become surrogate frontal lobes for the client. And my job is to ask the client the following question. One of my favorite questions to ask a client is, I say to them, let me ask you something a bit different, perhaps unusual. Do you, the client, find yourself out there in your day-to-day experience asking yourself the questions that we ask each other right here in therapy? That is a very clever question. Do you, the client, find yourself out there in your day-to-day experience asking yourself the questions that we ask each other right here? And what I'm conveying to the patient is I want them to take my voice with them. I want them to become their own therapist. So insofar as they could start to ask how and what questions, how did they come to the decision that, what are the alternatives that I could try, how would it work, how would I know when it changed, what would other people notice about this, how can you, the therapist, be of help to me at this moment in time? So included in my work are the very kinds of best questions that I think a therapist can ask. I think the most valuable tool that you, the therapist, have are, in fact, the questions that you ask, because you are modeling a style of thinking that you would like the client to engage in.
Thank you so much. There's a lot for me to think about there. Don, there's a couple of questions here if we have time, which where people are asking a little bit more granularity around some of the points that you've made so wonderfully. One of them was about the watching of violent material as a key criteria, and the question here was, what about things like horror movies or sort of fantasy type violence? Is there any information on this? Do we know what type of violent material is particularly indicative?
I don't think so. It's a matter of frequency and intensity. It's not that it's Halloween and you watch a scary movie with your partner. That's not problematic per se. It's the degree to which these men may peel off and go into a pornographic site where there is violence and the like. So that for me is a warning sign. The preoccupation with sports or other activities where there's violence is so normative in our culture that I wouldn't highlight it as a kind of risk factor per se. And it's important to note that in this description, there is often research to indicate that women could be highly violent also. in about 40% of the cases. So this is a two-way street. This is a dance that goes on. And it's important for both male and female to be cognizant of these behaviors. It is a pattern that occurs across all 5 behaviors that have become problematic. The guy love bombs. I'm concerned about my gut when I'm with him. I am preoccupied with the presence of risk factors. I've had warning signs from significant others in my life who I trust. I perform various kinds of behavioral samples that have led me to have some concerns. It is that kind of tally across all of those 5 categories that should give women pause. And I really encourage people to not hesitate in soliciting that kind of information.
Wonderful. And again, if I can just ask this question as it's come in, any indication that particular professions, particular daily exposure to any particular activity is particularly more high risky? The question here is police, military, things like that. Is there any indication of that?
There's some indication that various athletes who engage in professional sports where there's a great deal of violence, for example, in football or hockey or wrestling or those kinds of activities, might have a spillover of that kind of social interaction in the home situation. But I don't want to exclude any particular occupational group per se. Some occupational groups are more likely to indulge in substance abuse, which is a high risk marker. Some of these occupational groups may hang around with a cultural group who think that men are the head of the castle, who tolerate various kinds of violent behavior. There isn't any particular occupational group I want to exclude. It's just that the particular occupational group is more likely to put the individual at risk because of associative activities.
Yeah.
And it's the combination therein that would lead me to have some concerns. Does that, as far as I know, psychologists are safe.
Good to know. I'm just checking. There's just checking the messages coming in. Interesting question here in the sense of eliciting a sense of hope for the future, I think, which we're very keen on under looking at your approach. If somebody who has been abusive undergoes therapy, do we know what the success rate is? How likely is change?
Once again, it's the presence or absence of these various risk factors. It is influenced not only by how they respond to the therapeutic approach, which can indeed be successful in about half the cases. It's the degree to which there are any kind of other protective factors that we should be looking for. In terms of the commitment that these people make that they won't do this, the degree to which they evidence that they've been sorry about this, the degree to which they have now made small changes in terms of the social discourse, I get concerned about whether there is still ongoing risk factors that will contribute to this guy engaging in violent behavior again.
Yeah.
once again, I'd encourage the woman to trust their gut in this change process and then behave accordingly. Just remember that they have to leave safely no matter what time of the relationship they're in.
I was just talking to a colleague this afternoon, and one of the words of yours that sticks with me is when you say our first role as a psychotherapist is to prevent re-victimization, and I think that's talking to the same thing here. Final question from my side, unless there's any more. I think I've tried my best to bring together some of the questions that have come in when they've been of the same theme, and I tried to pull those together for Don. I was just wondering if I could step back from this whole project and initiative that's been quite a big part of your life for quite a long time, and just ask, was there a particular situation or case that made you think we need as a society to be focusing more on prevention and not just on treatment?
Well, I have been involved in many instances of where there's been violence. So, for example, I met with the mental health workers after 9/11 in New York. I met with survivors of the Oklahoma bombing, of the Los Angeles shooting, Las Vegas shooting. I have been a therapist who's dealt with parents for whom their children have engaged in various kinds of suicidal acts. I was involved in the Florida student march after the school shootings therein. The way I cope with all of these kinds of victimizations is I engage in social action. So your audience is welcome to visit the Melissa Institute, where I have written about how to predict violence in individuals, where I have written about conducted workshops on school safety, on grief, and the like. So my way of coping has been to engage in some kind of social action. And for 30 years, I have devoted my time free to the Melissa Institute. And this institute has survived and helped others around the world. So the notion is, I don't have one particular case per se, Chris, although I can think of a couple. I have mainly these kinds of social events that I think we as a society need to address. And I welcome this audience to help me and the Melissa Institute. Feel free to make a donation to the Melissa Institute. And I want to thank you and the college for giving me the opportunity to present the information about our book. I hope everyone goes and buys several of these, gives it to your daughters, your granddaughters, your friends, and the like, and that we have occasion to meet again down the road. Thank you, Chris.
I hope so too, Don. There is a lot of chat going on, just expressing their huge gratitude for you tonight, and thank you so much for your time, which you give so generously. Wonderful evening. It's given me so much to think about. Thank you so much to you, Don, but thank you to my colleagues as well. Brilliant. And thank you all for being here. Wonderful. I did, for those of you, I have put, Don's given a summary and some slides from another presentation, which are actually going into quite a lot of detail on the content of the book, and he's given those away for free. They are in the chat. I will make sure those are available to distribute as well if anybody needs those. So yeah, Don, thank you so much. And Mark, Lindsay, Heather, anything to come in?
Thank you, Don. It's been a real privilege to hear you live.
Well, thank you for joining me and raising those questions.
I look forward to seeing your next dream come to fruition.
Yeah, thank you, Don. Again, just for sharing your wisdom and just being so generous with your time. It's always appreciated. Thank you.
Thank you for sharing your story with us, Heather. And
Don,
thank you, Mark.
I've been listening in the background, coughing and sneezing quietly because I have a cold, but I've been listening. Wonderful. And we're just so happy to support your work and sharing your wisdom, and sharing as much of it as you can. And you're looking great, and just keep going. Wonderful to see you.
Yeah, I'm still plugging away. You know, I'm not quite there, but I'm actually in the home of my son. I sold my own home, and they're looking after me. So best wishes to one and all.
Fabulous. And I think we should finish by saying, Don's course, there's both a workshop we recorded with Don, which is our first contact together, our first collaboration. There's a workshop which is treating post-traumatic stress disorder and co-arising disorders and the keys to resilience. And that is on our website. That's recorded. It's a really nice historic event. And then from there, also, we went on to do this project where Don asked if we would help create this, what he calls his legacy course, where he's really transmitting and sharing as much wisdom and knowledge as he can. And so that is available. We will run it live again soon. If you want us to run it live, please let us know. We have, we're getting enough people in to run that, and have the facilitators there is sometimes a challenge. So it's available as a digital recording, but Chris has run it live and facilitates it. And sometimes when we're running it live, Don drops in, right, Heather, and does a little bit of spontaneous supervision and coaching.
Yeah, I mean, how cool could it get? It's just brilliant.
I love to drop in like that.
Yeah, and but it was just so amazing for the people who were doing the course to have you there. It just, yeah, I know that everyone just loved that opportunity.
Well, let's do more of that.
I recently
Did you hear that, everyone? Did you hear that?
Yeah. Everybody book into that.
Yeah.
I was recently using Grok. It's one of these AI systems. I said, what do you think about this person, that person? I said, Grok, what do you think about Don Meichenbaum? And it came back and said, oh my God, he is a titan in the field of psychotherapy. So I think that's quite a nice summary. Courtesy of Elon Musk, really, Don, but what to say,
I better cut off. This is going to my head. Take care, one and all.
Lovely to see you, Don. Take
Lovely
care.
to see you.
Good night. Don. Bye.
Thank you, panelists. Great job. Thank you, attendees. And yeah, I'm sorry if we didn't get to all your questions. I'm sure we could probably note them, any that you want answering, pop them in. I'm sure Don will be happy. Chris will facilitate that, and Don will be happy to respond back about them. So
yeah, well, I'll try and put a response together, either based for those that did perhaps get answered. I can draw from the transcript, or if there's anything that we did miss, we'll have a look at those again. Yeah,
and he does quite like if you write to him, dhmike@aol.com, right? Does he still give that out, Chris, or not? Maybe I shouldn't say that.
I think so. I think that's okay.
He loves to hear from people. So, and
yeah, it's in the back of his book. So,
yeah, somehow I think it keeps him going. He's 85 and has had a heart attack and was declared dead for about 14 minutes, I think, in the midst of that heart attack, and then has been recovering and just wants to get on and write more and share more. And so do reach out to him. Thank you, Lindsay. Thank you, Heather. Great seeing you. meeting you for the first time. Thanks, Chris, for all your great work, setting this up, facilitating it, and Chris is our main sort of project lead with Don, is just doing great work in terms of helping share all this and make it happen.
Well, thank you.
And it wouldn't happen if it wasn't for you all coming as well,
100%.
dear ones who attended webinar.
And this was a good, we had a good show tonight, didn't we? We had a lot of people. Brilliant. It's wonderful to see.
Good.
Yeah, great. And thank you because you can hear Mark is not his norm quite himself. So thank you so much for still being here. So
good. And maybe we can put we can send around that reading list. Don's recommended books, The End of Trauma.
yeah,
I'm going to put a plug in for Salter on that as well, in terms of if you want to get in touch with your intuition. If you're inhibited, you don't even know what you're feeling half the time. And Salter's chapter on masochism and sex, people whose lives are normalized, pain has become a normal part, that they don't know what a good relationship feels like. That's really interesting. And Don's comments about that, that aspect of the therapeutic relationship there, really helping them feel what a good relationship feels like. That's a really interesting, and reconditioning these positive experiences, rehearsing the positive pathways, if we might call it that. So yeah, if we could put that together, I think that's just helpful.
no problem.
Great. More people read, the better.
Yeah.
So fabulous. Okay, well, thank you so much. This is been going out live on YouTube, so it will be available. We'll get the link out to you as well, but you can be able to see it on our live stream channel on YouTube as well. So do share it with others. Yeah, do share with others.
And there was a quite somebody couldn't open the link, the documents that I attached. I will put those in the hub as well, and I'll also get a summary for everybody. No problem at all.
Okay, and I'm going to plug again, vaping. How to Stop Vaping with Dr. Chrissy Ivings, clinical psychologist, smoking cessation researcher, and myself, next Thursday, October 30th. Come along. It's going to be a juicy conversation.
Looking forward to that.
Okay. Thank you, everyone.
Good night, everyone. Thank you so much.
Sweet dreams.
Good night. Good night, everyone.
Thank you, Lindsay and Heather in particular, for being here and being on the spot. Wonderful. Thanks.
Thank you, Chris. And feel better, Mark.
Thank you. Okay. Good night.